The last scholarly article is Gettels and et al. Concussion Prevention. Gettels et al.'s purpose of this research was to examine current prevention strategies for concussions in sports, such as preventative strategies included giving insights to athletes, educational interventions, and evaluating education methods to reduce concussion risks. The procedure through this study was to educate the athletes on the risk of concussions and provide preventative methods. The participants in the education interventions range from ages 8 to 18, both male and female. The intervention proved that trained professionals of concussions were those educated previously on concussions, such as coaches, athletic directors, and physicians. The method of review was to examine the educational components that target concussions awareness, such as books, journals, and online databases. They found that putting different terms into the online databases, such as sport, safety, or knowledge, that then showed irrelevant articles were then eliminated, giving them articles that were beneficial to concussion research. Any educational intervention studies that did not include a post-evaluation of the athletes after having concussion were also eliminated, as it was irrelevant data. The results ended up that the concussion intervention proved that some articles responded with negative or mixed results of concussion education, and a few evaluated the impact education has on concussion rates and the cost of injuries. Interventions with no follow-ups and no study, and there was no studies that focus on helmet use with concussion components. The study proves that recommendations to provide the best educational initiatives reduce the rate of concussion in sports. And the best prevention overall was for concussion overall was education. This is very applicable to my research because it shows the importance of educating athletes in addition to coaches, because they are the stakeholders of the athletes. There's coaches, administrators, and trainers, and the best strategy is to be prepared and prepare their athletes so that concussions can be preventative. Preventative impacts and concussion awareness programs, they'll help athletes with their knowledge of concussions and recognize the symptoms, and then have a return to play procedures after suffering a concussion.